I'm Dr. Rich Sadowski at Commerce Chiropractic here in Commerce Township, and today we're going to see how we evaluate and help treat lower back pain. So the first thing that we're going to do is we're going to evaluate the pelvis here, because the pelvis is basically the foundation for the rest of the spine. And what we found is that if there's any kind of dysfunction or problems here in the pelvis, or if it's not moving properly, it can set the stage for other problems throughout the spine. So the first way we're going to evaluate that is by doing a simple orthopedic test called Noc List Test. And what we do here is we're going to bend the leg, and when we bend the leg, we pull the front muscles of the thigh here, which attach to the pelvis, and the pelvis usually rotates if it's moving properly. So you can see on our patient here that when we bend the leg, he flexes to about 120 or so degrees. And we're going to check the other side. So relax your leg when we do all the lifting. And we come up to, as you can see, about a little past 90 degrees here, and he's already kind of getting hung up there. So what that shows me is that there's two big joints here in the pelvis called the Sacroiliac Joint. You've got a pelvic bone here, one here, and then the tailbone in the center. And on each side, they should pivot. And what we're seeing is, and what we're looking for is symmetry. So left leg is moving about 120 degrees, so that's shifting real nice. Right side is only about a little more than 90 degrees, so we know that this is stuck over here. So we want to keep that in mind. Next thing we're going to address is the hips right here. And what we're going to check for is rotation. We're going to externally rotate, and that's real nice. That's about 45-50 degrees, which is excellent. And what we want to see here is symmetry as well. So we would hope to see the same thing on the other side. And we're hardly moving at all here. So what that tells me is that this joint here in his pelvis is not moving. So now when he's walking, instead of the pelvis shifting both ways and moving nice and equally, he's stuck on the right hand side, which is tightening up these muscles that go over to the hip here and restricting how his hip works. So we are going to make an adjustment. The way we adjust is we use an impulse IQ adjusting instrument. And what this instrument does is it does a quick mechanical thrust, like a tapping, anywhere from 6 to 12 hits per second. And this instrument is interesting because it has a built-in sensor or an accelerometer which measures the motion of the joint, speeds up or slows down to match that motion, and when it restores full motion, it beeps and turns off for us. So we're going to find that joint, we're going to put it on our higher setting, and we're going to get in there, and you can hear that beeping. That's the instrument telling me that it's reached good motion. We're going to go a little bit lower on the joint, and a little bit higher in the joint. Okay, now we're going to go back and we're going to reassess that motion, see if anything's changed. And you can see that he's just about back to being symmetrical with the other side. Now we're going to also adjust the hip here. So we're going to adjust the insertions where those muscles sit and release the hip. And see if that makes any change. And a little bit of change. He might need a couple adjustments to help really get that back to normal. Now the next thing we're going to assess is, since we restored motion here in the pelvis, we want to check the lower back. The lower back is made up of these individual bones that all have to turn, rotate, and bend. And what we'll find is that if the pelvis isn't moving properly, that restriction of motion then has to be made up or pulled from somewhere else. So it usually pulls on the spine here. So as we run our hand up the spine, any tenderness about here?
Yeah.
Yes. And the reason it's tender is because it's been irritated from being tugged over to the side. So what we're going to do is we're going to put on our little adapter here that gets on both sides of the spine. We're going to make that adjustment. And restore the function there. Good, that's better. And what I'm feeling for here is when I run my hands across the spine, it's kind of like piano keys, where you can run your hand across them, they kind of bounce down and bounce back up. And here in the spine, because that area is irritated and a little bit swollen, when I go to press on them, they don't really press down, they don't really bounce up. So when we make that adjustment, we restore that motion. Once the pelvis is working better, hips are working better, now his spine can move and rotate and work like it's supposed to, and then his body takes over and fixes everything. And that's how we fix lower back pain.